Hello, and a warm welcome to Dr. Nguyen's YouTube channel, your trusted source for health information. Today, we're going to explore diabetes, a condition affecting millions worldwide. We'll walk you through an overview, its causes, symptoms, and diagnosis. We will also cover various treatments, both medical and non-medical complications that may arise, and how to prevent it. It's a comprehensive guide that simplifies the complex world of diabetes. So, buckle up as we delve into the world of diabetes, a condition affecting millions worldwide. Diabetes is a chronic health condition that affects the body's ability to process sugar. This is a simple yet profound truth about a disease that affects millions worldwide. But what exactly is diabetes? It's a disorder where the body either doesn't produce enough insulin or can't use the insulin it produces efficiently. Insulin is a hormone that allows cells to absorb and use glucose, which is the body's primary energy source. When this system is disrupted, glucose builds up in the blood, leading to high blood sugar levels. This condition manifests in two primary forms, type 1 and type 2 diabetes. Type 1 is an autoimmune condition where the body attacks its insulin-producing cells. Type 2, the more common variant, develops when the body becomes resistant to insulin or when the pancreas can't produce enough. Both types can lead to serious health complications over time, affecting the heart, kidneys, eyes, and nerves. Understanding diabetes is the first step towards managing it effectively. So what causes diabetes and how does it manifest itself? Diabetes is a chronic condition that arises when the body's ability to produce or respond to insulin is impaired, resulting in abnormal metabolism of carbohydrates and elevated levels of glucose in the blood. But what leads to this impairment? Let's delve into the causes. Type 1 diabetes, often diagnosed in childhood, is an autoimmune condition. The body's immune system mistakenly attacks and destroys insulin-producing cells in the pancreas. The exact cause is unknown, though it's believed genetic predisposition and environmental factors like viruses may trigger this attack. Type 2 diabetes, the more common type, is primarily caused by lifestyle factors and genetics. A sedentary lifestyle, obesity, and a diet high in processed foods can contribute to insulin resistance, where your body doesn't use insulin properly, leading to high blood glucose levels. Gestational diabetes, which occurs during pregnancy, is caused by hormonal changes that make your body less responsive to insulin. This type usually resolves after childbirth, but it does increase the mother's risk of type 2 diabetes later in life. Now let's talk about the symptoms. Often diabetes can be a silent condition, showing no overt signs until complications develop. However, common symptoms include frequent urination, excessive thirst, unexplained weight loss, constant hunger, fatigue, blurred vision, and slow healing sores. In type 1 diabetes, symptoms usually develop quickly, within weeks, but with type 2, symptoms may be so mild and develop over such a long period that you might not even notice them. Gestational diabetes usually doesn't show symptoms and is often diagnosed during routine pregnancy screening. In all cases, early detection is crucial. If you're experiencing any of these symptoms, especially if you're over 45, overweight, or have a family history of diabetes, it's essential to get checked. Knowing the causes and symptoms can help in early detection and treatment. Taking control of your health begins with understanding. Stay informed, stay vigilant, and remember, awareness is the first step towards prevention and management. Scene script. Diagnosis of diabetes involves a series of tests, and the treatment can vary based on the type of diabetes. When it comes to diagnosing diabetes, doctors mainly rely on two tests. The first is the fasting plasma glucose test, which measures your blood sugar level after an overnight fast. The second is the oral glucose tolerance test, where your blood sugar levels are checked 2 hours after you consume a special sweet drink. If either of these tests indicates high blood sugar levels, your doctor may diagnose you with diabetes. However, it's important to note that these tests alone cannot differentiate between type 1 and type 2 diabetes. That's where additional tests, like the C-peptide test, come into play. This test measures the amount of insulin being produced by your body, helping to distinguish between the two types of diabetes. Now, let's turn our attention to treatment options. If you're diagnosed with type 1 diabetes, your body cannot make insulin, so you'll need to take insulin daily. This can be administered through injections or an insulin pump. For those with type 2 diabetes, the body either doesn't make enough insulin or doesn't use it effectively. The first line of treatment usually includes lifestyle changes like a healthier diet and more physical activity. If these changes don't improve blood sugar control, oral medications or insulin may be prescribed. In some cases, people with type 2 diabetes may benefit from bariatric surgery, which can lead to significant weight loss and improvement in blood sugar control. It's also worth mentioning that there are numerous ongoing research studies aiming to find new and better ways to manage diabetes. Remember, diabetes is a lifelong condition, and managing it requires ongoing care. Regular checkups with your healthcare team, self-monitoring of blood sugar levels, and adherence to your treatment plan are crucial in controlling the disease. Diagnosis and treatment are crucial to control the condition and prevent complications. With the right care and treatment, people with diabetes can lead a healthy and fulfilling life. Beyond medical treatment, lifestyle changes play a significant role in managing diabetes. When it comes to non-medical treatments for diabetes, diet and exercise are the two pillars. A balanced diet, rich in fruits, vegetables, lean proteins, and whole grains, can help regulate blood sugar levels. It's not about strict restrictions, but rather making healthier choices and maintaining consistency. Exercise, on the other hand, is just as crucial. Regular physical activity, whether it's a brisk walk, a bike ride, or a dance class, helps lower blood sugar levels and boosts insulin sensitivity. It's all about finding an activity you enjoy and making it a part of your daily routine. Now let's talk about potential complications. Uncontrolled diabetes can lead to a host of health issues, from heart disease and nerve damage to kidney problems and eye conditions. In some cases, it can even lead to limb amputation. That's why regular checkups and blood sugar monitoring are essential for anyone living with this condition. And what about prevention? Can diabetes be prevented? In many cases, the answer is yes. Type 2 diabetes, the most common form, is often linked to lifestyle factors. This means that making healthier choices can significantly reduce your risk. Start by maintaining a healthy weight. Obesity is a major risk factor for type 2 diabetes, so shedding those extra pounds can make a huge difference. Regular physical activity not only helps you lose weight, but also keeps your blood sugar levels in check. Nutrition is another key factor. Opt for a diet low in processed foods and high in fiber. This can help regulate your blood sugar levels and keep your weight in check. And remember, it's not about drastic changes, but sustainable habits. Lastly, regular health checkups can help detect any early signs of diabetes and allow for prompt treatment. Prevention and non-medical treatments allow individuals to take control of their health and live well with diabetes. As we wrap up, let's recap the main points about diabetes. We've journeyed through a comprehensive overview of this condition, understanding that it's a persistent disease that affects the way our bodies process sugar. We delved into the causes and symptoms, highlighting that it stems from either the body's inability to produce insulin, as in type 1, or it starts resisting insulin, as in type 2. The symptoms are often subtle, but can include frequent urination, excessive thirst, and unexplained weight loss. Our exploration of diagnosis and treatment informed us that blood tests are the primary method of diagnosing diabetes, and insulin therapy forms the cornerstone of its treatment. However, treatments can vary depending on the type and severity of the condition. In terms of non-medical treatment, we learned about the pivotal role of a healthy diet and regular exercise. Complications can be severe if left unmanaged, affecting the heart, kidneys, and even leading to blindness. But the silver lining is that with suitable lifestyle modifications, these complications can be prevented. Remember, diabetes isn't a death sentence. It's a condition that can be managed with the right knowledge and actions. Thank you for joining us on Dr. Nguyen's YouTube channel. Remember, knowledge is the first step towards a healthier life. Until next time, stay healthy and informed.